Do you know what eczema is and how it affects people? Perhaps you've heard of it as atopic dermatitis, a skin condition that causes dry, itchy, scaly, and red skin. This isn't a picky condition, as it can affect anyone from infants to adults, and it seems to be more common in certain families. But don't fret, because there are treatments available, including moisturizers and prescription ointments and creams. The cause of eczema remains somewhat elusive, but genetics seem to be a major player. If you come from a family with a history of eczema, your risk of developing the condition increases. In most people with eczema, there's a genetic abnormality in the outermost layer of the skin, the epidermis, which normally acts as the body's first line of defense against environmental irritants, allergens, and microbes. However, in the case of eczema, this barrier isn't as robust as it should be. Contrary to popular belief, food allergies are rarely the culprit for eczema in children. If you suspect a food allergy, it's best to consult an allergy specialist. Eczema usually makes its first appearance before the age of 5, with symptoms such as intense itching, inflamed skin patches, and skin flaking. Scratching can exacerbate the condition, leading to further inflammation and worsening the itch. The itchiness tends to become more prominent at night. The manifestation of eczema differs from person to person and can change over time. It can affect multiple areas of the body in severe cases. In infants, it's commonly found on the front of the arms and legs, cheeks, or scalp, while in children and adults it tends to affect the back of the neck, the elbow creases, and the backs of the knees. Repeated scratching can lead to thickened, darkened, or even scarred skin, and in some cases, skin infections. Eczema can present other symptoms too, such as dry, scaly skin, plugged hair follicles, increased skin creasing on the palms, and even darkening of the skin around the eyes. Diagnosing eczema isn't done through a specific test, but is usually based on your medical history, symptoms, and physical examination. Factors that strongly suggest eczema include long-term and recurrent itching, early onset of symptoms, and a personal or family history of certain allergic conditions like asthma, seasonal allergies, and of course, eczema. Eczema is a chronic condition that tends to improve and flare up periodically. Some people may even have no symptoms for several years. While it's not curable, it's certainly manageable with self-care measures and medications.
Identifying and eliminating factors that aggravate your eczema symptoms can help control the condition. Eczema is triggered by various factors, and the first step in managing it is recognizing these triggers. Cold or dry environments can cause your skin to dry out, leading to an eczema flare-up. Sweating can also aggravate the condition, as can emotional stress or anxiety. Rapid temperature changes and exposure to certain chemicals or cleaning solutions, including soaps, detergents, perfumes, and cosmetics, can also trigger eczema. Even certain fibers such as wool or synthetic materials, dust, sand, and cigarette smoke can be potential culprits. So what can you do to keep eczema in check? One solution is to keep your skin hydrated. Emollients, for instance, are lotions, creams, and ointments that moisturize the skin and prevent it from drying out. Thick creams like Eucerin, Cetaphil, and Nutriderm, or ointments like petroleum jelly, Aquaphor, and Vaseline, which contain little to no water, are best for people with eczema. Apply emollients immediately after bathing for maximum effect and repeat twice a day or more often if needed. Speaking of bathing, it's unclear whether showers or baths are better for keeping the skin hydrated. However, lukewarm baths or showers can hydrate and cool the skin, temporarily relieving itching from eczema. Use an unscented mild soap or non-soap cleanser sparingly. Apply an emollient immediately after to prevent your skin from drying out due to water evaporation. However, avoid hot or long baths and showers that last more than 10 to 15 minutes, as they can dry out the skin. In some cases, healthcare providers may recommend dilute bleach baths for people with eczema. These baths help decrease the number of bacteria on the skin that can cause infections or worsen symptoms. To prepare, add between 1/4 and 1/2 cup of bleach to a full bathtub of water. Take these baths for 5 to 10 minutes twice per week, followed by an application of an emollient.
We're delving into the different treatments for skin irritation and eczema. Let's kick things off with topical steroids. These creams or ointments, also known as corticosteroids, are often the first line of defense against mild to moderate eczema. Available in varying strengths, the least potent like hydrocortisone 1% cream, can be purchased without a prescription. Apply these once or twice a day to reduce symptoms and moisturize your skin. As your skin improves, transition to a non-medicated emollient. However, for severe flares of eczema, stronger topical steroids may be necessary. It's important to remember that these should only be used for short periods to prevent skin thinning from long-term use. But topical steroids aren't the only game in town. Other skin treatments such as tacrolimus ointment and pimecrolimus cream can also help control eczema. While they may not work as quickly as topical steroids, they can be used on sensitive areas like the face and groin, and are safe for children over the age of 2. However, due to long-term safety concerns, always follow your healthcare provider's instructions on how and for how long to use them. In cases of severe eczema flare-ups, oral steroids like prednisone can be used, albeit for a very short period. This treatment isn't usually recommended regularly or for prolonged periods due to potential side effects. Next up, we have ultraviolet light therapy or phototherapy. This treatment can effectively control eczema, but it comes with a hefty price tag and an increased risk of skin cancer. Hence, it's only recommended for those with severe eczema that doesn't respond to other treatments. Injectable medications are another option. Biologic medication like dupilumab can prove beneficial for treating eczema. However, due to its high cost and potential side effects, it's reserved for adults and children aged 6 months and older with moderate to severe eczema that hasn't responded to other treatments. Another similar medication is tralokinumab, which can also be used in adults. Lastly, for those with severe eczema that doesn't improve with other treatments, immunosuppressive drugs might be recommended. These drugs weaken the immune system, but come with serious side effects, including an increased risk for infection. They're not recommended for use in infants or young children.
The first stop on our tour is the realm of oral antihistamines. These medical marvels sometimes help alleviate the itch associated with conditions like eczema. Over-the-counter antihistamines such as diphenhydramine or prescription variants like hydroxyzine and cyproheptadine can be particularly beneficial. They possess an added advantage. They induce drowsiness, which can be a boon for those who have difficulty sleeping due to itching. If drowsiness isn't your cup of tea, fret not. Non-sedating antihistamines like cetirizine and loratadine might be your allies. They are readily available, cause less drowsiness, and can help relieve itching. Next, we explore the world of wet dressings. These are dampened cotton garments, such as gauze, worn over the affected area. Wet dressings can soothe and hydrate the skin, reduce itching and redness, loosen crusted areas, and prevent skin injuries due to scratching. You can wear them for a few days, overnight, or during the day, changing to a fresh dressing every 8 hours. But what if the itch affects more than just your skin? Itching and conditions like eczema can sometimes cause anxiety or depression. Never hesitate to bring up these issues with your healthcare provider. There are treatments available that can help. Finally, we touch on prevention. While there isn't a surefire way to prevent conditions like eczema, good skincare might be beneficial, especially for those at higher risk. This includes using moisturizing creams or ointments. It's crucial to remember to wash your hands before application to lower the risk of introducing germs on the skin. Opt for products that come in a tube instead of a jar, where you dip your fingers in.